If you ever need to visit a doctor or go to a hospital, you absolutely must know the right English words and sentences. What do you say to book an appointment? What might you hear when you describe your symptoms? In this episode, I'll teach you all the essential English you need, from checking in at the reception desk to understanding your treatment plan. Get ready to learn the English you need to feel calm and confident in any medical situation. Now, I want you to just listen to me and try to say them with me. That's all you need to do, because, my friends, there's no shortcut to learning a language. But with me, practice and focus, and you'll keep improving and sound more natural every day. Hello and welcome back to the Ravand English Podcast. I'm your host, Brandon, and I'm so happy you're here for this very important episode. Today's topic is English for the hospital and doctor, a serious but practical part of everyday life. We've divided the lesson into 5 key parts to help you speak confidently about symptoms, treatments, and appointments. Part 1. Making the appointment, the phone call. When you need medical help, the first thing you usually do is call the clinic or hospital. It's important to sound polite and clear when you ask for a time to see the doctor. Let's go step by step. Always start by introducing yourself. It's polite and helps the conversation go smoothly. For example, you can say, "Hello, my name is Brandon." You can introduce yourself. Then tell them why you're calling. Use the phrase to schedule an appointment. It simply means to book a time to see the doctor. I'm calling to schedule an appointment. This sentence is very important. Try to learn it here, memorize it, and try to say it out loud with me. I'm calling to schedule an appointment. Next, explain your situation. If you don't feel well, use this natural sentence. I've been feeling unwell, and I'd like to see a doctor. I repeat that. I've been feeling unwell, and I'd like to see a doctor. This is the most important sentence in this part. Notice how it is structured. I have been feeling unwell. The main problem that language learners have is they don't know how to start the sentence. This structure uses the present perfect continuous tense, which is perfect here. Why? Because it shows that you started feeling sick in the past and you are still feeling unwell right now. It is the most natural way to start describing your symptoms. Unwell as a polite word that means sick or not feeling so good. So let me repeat that one more time for you. I've been feeling unwell and I'd like to see a doctor. Sometimes you're not sick. You just want to make sure you're healthy. That's called a routine checkup, which means a regular medical exam. For example, you can say, I need to schedule a routine checkup. Getting regular checkups is really important, my friends. It helps doctors find any health problems early and prevent serious issues later. So I repeat that one more time. I need to schedule a routine checkup. Now, if you want to ask about available times, you can use the word slots. It means open times on the doctor's calendar. For example, you can use this sentence. Could you tell me what slots are available next week? Could you tell me what slots are available next week? Please repeat after me. Could you please tell me what slots are available next week? You can also tell them when you are free. For example, I'm available in the mornings, or I'm available in the afternoons. This helps the receptionist find a time that works for both of you. I'm available in the mornings, or I'm available in the afternoons. Before you finish the call, it's important to confirm the details, the day and time. You can say, could you please confirm the date and time of my appointment? Could you please confirm the date and time of my appointment? And finally, always thank them politely. Thank you for your help. I'll see you on Monday. Are you ready for the next part? Let's go. Part 2. Checking in and dealing with the bill. When you arrive at the clinic, you need to check in, right? Just like hotels and airports. To check in. This means telling the receptionist you're there. You can use these sentences. I have prepared 4 example sentences for you. Example 1. Good morning. I have an appointment with Dr. Johnson. Good morning. I have an appointment with Dr. Johnson. Repeat after me. Good morning. I have an appointment with Dr. Johnson. I'm here for my consultation with Nurse Sarah. I'm here for my consultation with Nurse Sarah. Good evening. I have an 8 p.m. appointment. I have an 8 p.m. appointment. Hello, I'm here to see the doctor. Hello, I'm here to see the doctor. The receptionist will ask for your identification. For example, he or she might say, could you please confirm your name and date of birth? Could you please confirm your name and date of birth? He might say that a little faster than me. Could you please confirm your name and date of birth? Could you please confirm your name and date of birth? You might also need to provide proof of identity. You can say, here's my ID and my insurance card. Thank you. Please take a seat in the waiting area. The waiting area is just a room where you wait until the doctor calls your name. If the waiting room is full, you can ask about the expected delay. How long is the approximate wait time? How long is the approximate wait time? Approximate wait time means about how many minutes or hours you should expect to wait. How long is the approximate wait time? If you have to change your next visit, you can use the word reschedule. Reschedule means to change the time or day of your appointment. Excuse me, I'd like to reschedule my next appointment. Excuse me, I'd like to reschedule my next appointment. Let's talk about insurance and payments. Health insurance is an agreement with a company that helps pay for a sum or all of your medical costs when you get sick. It can be a little confusing, so in the future, we'll have a full episode just about health insurance to explain it clearly. I have a health insurance with, then you can say the name of your company. Do I need to bring any specific documents? Let's talk about Copayment. The copayment, or simply copay, is a fixed small amount of money you must pay at the time of the visit. Even if you have insurance, it's a very important word to know. For example, you can ask, what is the copayment for this visit? Or, what is the copay for this visit? I have a question about my bill. Could you explain how the insurance coverage works for this treatment? It's a very good question. You should learn it. Could you explain how the insurance coverage works for this treatment? The next part is very important, my friends, because we're going to be talking about describing your symptoms. So let's go to the next part. Part 3. Describing your symptoms. This is the most important part. The doctor needs to know exactly what is wrong. What is wrong with you? I'm going to give you key symptoms and the best way to explain them. Let's use the phrase, I have it, or I've had it. I have it, or I've had it. For example, I have a persistent cough and a high fever. Or, I have a throbbing pain in my shoulder. I've had a lot of nausea for 2 days. I'm going to repeat the examples one more time. I have a persistent cough and a high fever. I have a throbbing pain in my shoulder. I've had a lot of nausea for 2 days. Hold on, a lot of new vocabulary words. Don't worry, I'm going to explain each and every one of them for you. Cough is when you push air out of your lungs quickly. Fever means your body temperature is too high. Persistent means it doesn't go away. It stays with you all the time. Throbbing pain means the pain that comes and goes, like a strong heartbeat in that area. Nausea means you feel sick in your stomach and feel like you might vomit or throw up. This word has 3 acceptable pronunciations in American English. Listen closely. You might hear nausea, nausea, or even nausea. Can you believe it? All 3 are correct, so don't be confused when you hear them. I have a persistent cough and a high fever. I have a throbbing pain in my shoulder. I've had a lot of nausea or nausea for 2 days. I've been experiencing dizziness and fatigue recently. Dizziness means you feel wobbly or like you might fall down. And also fatigue is a very strong word for feeling extremely tired. So when you are very tired, you can use the word fatigue. I've been experiencing dizziness and fatigue recently. I have a bad headache and a sore throat. What is sore throat? What is a headache? Headache is pain in your head, and sore throat is when your throat hurts when you swallow. Oh my God, I hate this feeling. It's 7 a.m., you open your eyes, wake up, and realize your throat is sore, and you might have caught a cold. I absolutely hate it. How about you? Let me know in the comments. I'm having abdominal pain. Abdominal pain is just a more medical way of saying stomach pain. I'm having stomach pain. I'm having abdominal pain. I'm experiencing shortness of breath. Shortness of breath. This means You're having difficulty breathing. You can't get enough air into your lungs. Breathe versus breath. This is a tricky one. Breath is a noun, is the air that goes in and out, pronounced with a voiceless th sound. Breath, breath, like in death. But breathe is a verb. It's the action of taking air in and out, pronounced with a voiced th sound. Breathe, breathe, like in mother, father, breathed. For example, I took a deep breath. I took a deep breath. It's hard to breathe. It's hard to breathe. It's a verb here. I'm feeling nauseous and might vomit. Okay, nauseous means you feel sick in your stomach and you feel like you need to vomit or throw up. Nauseous, nauseous. I also hate this feeling. Let's go to the next part. Part 4, the doctor's consultation, diagnosis and treatment. Once you have explained your symptoms, the doctor will ask questions and decide on your next steps, right? The doctor will ask you, when did these symptoms start? When did these symptoms start? Are you currently on any medication? On any medication? Why did I say it like this? Let me explain. When we talk about taking medicine regularly, we almost always use the preposition on. It's the standard natural English phrase. We don't say, are you with any medication? The most natural way to ask is with on. So, are you currently on any medication? I'm going to repeat those questions one more time. When did these symptoms start? Are you currently on any medication? Doctor is probably going to ask you this question. Can you describe the pain? Is it sharp or dull? To answer this question from the doctor, you'll need to know some specific words and phrases. How do we really describe the pain? Don't worry. You have your teacher, Brandon. I'm here, and I will explain. When you describe pain, you don't just say it hurts. You need to use adjectives that tell the doctor how it hurts, right? Sharp pain. This means the pain is sudden, like a knife or a needle sticking you. For example, I have a sharp pain in my side when I cough. Dull pain. This means the pain is constant, but it's not very severe. For example, I woke up with a dull pain in my lower back. Aching pain. This is a continuous, general pain, often in muscles or joints. For example, my whole body is aching after the fever. Stabbing pain. This is very severe, sudden pain, like being stabbed. Burning pain. This feels like your skin or inside is hot or on fire. For example, I have a burning pain in my chest. Numbness. Numbness means a total lack of feeling. My fingers feel numb sometimes. The letter B is silent in this word. Numb. Do not say numb. Numb. Medication is the same as medicine. The doctor might say, I am going to prescribe some antibiotics. Take 1 tablet 3 times a day after meals. Prescribe means the doctor is writing an official order for medicine that you can buy at a pharmacy. We use the verb take when we're talking about consume in medicine. So you take a tablet, you take a pill, or you take a dose of syrup. Do not use eat. Don't say I eat a tablet. I take a tablet. We need to run some tests to determine what's causing your symptoms. To run some tests means to perform medical checks like a blood test or an X-ray. What are the possible side effects of this medication? Side effects are bad things that might happen when you take the medicine, like dizziness or fatigue. So I'm going to repeat those words one more time. Sharp pain, dull pain, aching pain, stabbing pain, burning pain, numbness. Prescribe. To take a tablet. To run some tests. Blood test. Side effects. Are you ready for the next part? Part 5. The nurse, hospital staff, and key vocabulary. This final section covers the rest of the medical environment, the staff who help you, the specialized room, and the crucial vocabulary you need to understand when the doctor or nurse talks to you. You might interact with technicians and need to know about specialists. Technician. Who is a technician? A person skilled in the technical aspects of medicine, like taking X-rays or drawing blood. Specialist. A doctor who has extra training and experience in a specific area of medicine, like heart problems or bone issues. For example, for your heart problem, the doctor is referring you to a specialist. Bedside manner. What does it mean? This describes how doctors and nurses talk to patients if they are kind, patient, and good communicators. The doctor had a great bedside manner, making me feel comfortable. Here are essential words you will hear about your condition and your visit. The first one is vitals. What does it mean? These are basic health checks. Your temperature, heart rate, blood pressure that nurses take regularly. We call them vitals. The second one is diagnosis. We had it earlier, right? What does it mean? This is the doctor's conclusion about what illness or condition you have after examining your symptoms. For example, the doctor's diagnosis was that I had the flu. The doctor's diagnosis was that I had the flu. The next one is prognosis. This is the doctor's prediction about your future health or chances of recovery. Despite the serious diagnosis, the prognosis is good. Discharge. This is the final step. It means the doctor finally releases you to go home from the hospital. Discharge is scheduled for tomorrow morning. Medical history. A record of information about your health, including past illnesses, surgeries, and allergies. We call them medical history. For example, the doctor took a detailed medical history before starting treatment. If you're staying overnight, you will be in a specific unit. You need to know these three. First is the ER, or the emergency room. It is the part of the hospital you go to when you have a sudden serious injury or illness and need help immediately. For example, you might hear, after the accident, he was rushed to the ER. Next, we have the ICU. This department treats the most serious and critical conditions where patients need constant monitoring. A nurse might say his condition was severe, so they moved him to the ICU. And finally, there's the ward. A ward is simply a large room in a hospital where severe patients with similar conditions are cared for. For example, after the surgery, they moved her to the recovery ward. This is a huge accomplishment. We have covered the essential English you need for any medical emergency or appointment. You can confidently describe your symptoms, ask for medication, and understand a diagnosis. Being prepared is the best medicine. If you found this helpful, please hit that subscribe button and leave a comment. It really helps me. Thank you so much for hanging out with me on the Ravand English Podcast. I'm Brandon, and I'm looking forward to chatting with you on the next episode. Goodbye, my dear friends.